I am always super, super grateful for urology practices and administrators coming to visit me from far away, and I'm very excited to have Parrish Morree, Dr. Parrish Morree, and her office manager, well, actually, group administrator, right? CEO Jamie, from Tennessee, also for coming all the way out here, taking 2 flights to get to Gilbert, Arizona. They spent the whole day here, basically visiting my practice, and we're just kind of winding down the day at a restaurant after a nice meal. I'd like to thank NeoTrack for sponsoring their visit here. So I've had a lot of different practices visit my practice, and they always tell me, okay, you run a practice efficiently. If you can just tell me maybe 1 or 2 things that you saw which was efficient in the office, instead of just saying, okay, it's an efficient practice. Jamie, can I start with you?
I like the scheduling part of it really well.
Okay, what about the schedule?
It's an open schedule, so you can fit anybody in at any time. I thought that was a good thing. You weren't restricted to what you could put in. It was based on what the physician can do while he's doing a vasectomy. Maybe 1 or 2, he can see another patient in between, and I thought that was very efficient.
How are you doing it in your practice now? I know you guys are in a group of, I think, total of 10 different providers and multiple different locations. Is that right? How are you templating your office visit practice?
We do block scheduling, so we have a certain amount of time set up for each type of appointment that we make, and we do that for each physician.
How do you handle, like, say, emergent walk-ins or add-ons?
We have work-in slots for each provider, and it could be 1 or 2 a day. We try to handle work-ins that way.
And how is that working out?
It's okay. I would like a little more flexibility.
So what do you like about your current setup with the block schedule?
What do I like about it?
Yeah. What do you think about it?
I think it's good and bad. I think there are perks to having a set template so that the people scheduling our clinics have an idea of where to put patients, but it's also less flexible. We're not really thinking through what we can do in a day, but more what are those titles. So.
Are you able to fill up the whole day because of these templated schedules, or sometimes you have gaps because of the template?
For the most part, we fill them up. Occasionally you'll have a gap because someone will cancel at the last minute or the day before, and you're not always able to fill that slot.
Okay, switching gears real quick. As an administrator, we've discussed that the biggest headache is HR, human resources. You guys have some really good incentives, and we also discussed how to keep good people, you have to create an environment that is conducive to keeping these new people. What are some of the things that you have done in your practice that is kind of fun to incentivize your staff and try to create a nice environment to keep them?
One of the things we did was our monthly staff meetings. Instead of it being strictly business, we tried to do, I guess you could call a sandwich technique, where you have a little bit of fun at the beginning, and then you talk about the needs and the requirements and the policies, and then at the end you end with something fun, and we do giveaways and different things for the staff.
What else do you guys do?
We have a wonderful Christmas party every year, where all the physicians, most of them go shopping and buy gifts for the staff, and we play a game during the party, and those gifts are all given to the employees.
And who does all the buying?
I do.
I'm giving her my credit card so she can do the buying for me for my Christmas presents for my staff. That's awesome. Okay, so now let's talk about clinical stuff. You saw how I see patients this morning, how I do the documentation, and especially managing the BPH patients. What are some of the things that you've seen specifically that you think are efficient?
I think the process from when the patient checks in to when you actually see the patient is very efficient. The flow and how your MAs or nurses get the patients ready for you is incredibly efficient, and you do what is required by you to do. So you do the essential pieces, the exam, the assessment and plan, and a lot of your other staff works together to get the other pieces done.
So exactly what do you mean that the staff is very efficient in getting the patients into the exam room?
Well, from check-in, the patient starts the process and the clinical note is opened. Their vitals are taken, that information flows directly into the hospital, the clinic chart. When you walk into the room to see the patient, the gloves have already been set out for you or are easily accessible.
The way it should be.
Yeah,
Because I'm the king.
your procedure's already been set up, the patient's positioned, the anesthetic has already been, at least initiated. And it makes your job very, I don't want to say easy, but
It is easy.
Is very efficient and timely, and then your documentation is timely afterwards.
And I've said this repeatedly today, the medical assistants and my whole staff, they make me look good, right? I'm just doing part of the work, but they really set me up for success. And your staff is really the key to any practice in making it successful. What about the management of BPH? What are some of the takeaways that you saw today as far as BPH management?
Well, I think it's important to offer the patient the spectrum of possible treatment options, specifically medications versus minimally invasive procedures. And I think you do a great job of letting patients know what their options are and properly informing them of possible side effects and complications. And really educating them on what there is available, particularly UroLift. I think that's a great option for patients, and you make the evaluation and the transition into that procedure very seamless.
Very good. You also had the opportunity to observe transrectal ultrasound, cystoscopy, prostate needle biopsy. Let's start with cystoscopy. What things did you observe that we do here differently than what you do in Tennessee?
Well, the room setup is different. You do have an excellent table. The video monitor is really nice for the patients and for you as well as your assistants, because they can kind of follow exactly what you're doing.
What is so special about my cysto table? It's just a standard, very old, low 18-inch table. Well, what do you guys use?
Several of our tables are fixed. We only have one table that's mobile. So being able to move the patient to
up and down.
Yeah.
Okay.
Yep. The cysto table that you use for UroLift is also pretty efficient with the basket that you have and the easy.
Oh, the little pull-out tray to
and
catch.
Yeah, and the stirrups are awesome.
The stirrups are made by G Stirrup out of Florida, believe it or not, and you can just order them, they'll ship it to you, and they adapt right on top of the existing stirrup, so you can really secure the legs.
It's a great option.
We can give you that. I'll link it in the video description, so anybody who's interested can find that. Okay, so cystoscopy, having the monitor, having a table that can move up and down. Those tables are pretty old, so you can probably find used ones affordably. Prostate ultrasound, prostate biopsy, anything different that we do versus what you do in your practice?
The biopsy needle, the gun that you use, is different from what we use. I mean, it's impressive. We use an assistant to help us remove the specimen and put it in the proper container, and you do almost all of that by yourself in 4 minutes or less, which is pretty impressive. So.
Okay, so it's maybe consider using a different device to make your process a little bit more seamless. Anything else that you saw after spending a day here in the office?
The way the CTs and the outpatient or the outsourced scans are done, I thought was very nice, in that the order's just sent to the facility and they do all the scheduling and all the pre-cert. That's very different than what we're doing currently. We schedule those, we pre-cert those, and that takes a lot of time. So I think if I was going to take away anything, it would be the scheduling and then probably that, to see what we could do to improve upon that and maybe push that back on the facility.
So believe it or not, this is not something, what you're saying is not something unique to my practice. A lot of practices across the country are doing the same thing, because we order the CT, urology practice, urologists order the CT. Why are we doing the work so that a radiology practice can do the CT when we can simply give them the information and they should be doing the pre-certification so that they can generate the revenue and take care of the patient? So it doesn't make sense. What we're doing is nothing unique.
I agree. I agree. It's probably not unique, but we get a lot of pushback from facilities not wanting to do that for diagnosis reasons or many things that they say, and they want us to get that pre-certed for them.
So what we do is we provide the patient information, demographics, insurance, and then include the office visit note with the facts, and we send everything over to them, and then they can do the certification themselves, which is probably a lot more efficient because they know all the codes that they need to use for billing, and they know their payers. And we would, if we were to do it, they probably won't get promptly paid.
I agree. That's one of my first duties when I get back is to
That's
know what
gonna.
I can do about that.
And how many FTEs will you save?
Oh, that would be 2.
Okay, you can send just like 5% over to me, from the money that you save.
We'll split it.
Okay, maybe like a Christmas present or something.
Okay, we can do a Christmas present.
Sounds good. Any parting words, Dr. Morree?
I don't think so. It's been a great experience. Yeah, thank you for having us.
And I encourage you to do more videos.
We'll see.
Jamie, anything else to add?
It's been a great day. I've enjoyed it. It was enlightening.
Well, you're very welcome. I really appreciate you guys taking the time and coming down. I know it's always a lot of work, and missing office and your family is always a big effort. And I'd like to thank NeoTrack for sponsoring everyone. And off screen over there is Vicky. She's the LPN. She's not talking. And we have Rodney, who's the NeoTrack rep in the background. I really appreciate you guys supporting everyone and bringing them down here so that we can share best practices for performing the UroLift system and helping more men with enlarged prostates. So thank you all for watching. If you have any questions, please leave them in the comments below. I look forward to hearing from everyone. Take care.